If you're in the very early stages of a labour, your contractions might be a little bit inconsistent, or you might not know if it's necessarily proper labour contractions. You might be having some Braxton Hicks or some prodromal labour. Here are some mobility movements that are quite beneficial to help with baby engaging down onto the cervix. So remember, head engagement onto the cervix is what helps to release oxytocin, which helps to drive more uterine contractions and then dilate the cervix even further. So creating some uneven movements or mobility exercises can be really helpful to assist with getting baby in the best possible position to come down. As they're entering the pelvis, they do have to slowly and steadily rotate, and that allows them to then be birthed out, but we need to actually get them into the best position first. So hands and knees, you can always do a little cat-cow if you're finding your back's overly stiff or sore, and that can be really useful for pain, but we actually recommend little wiggling movements side to side. I think of them as little tail wags, just rotating side to side while you're here. And what you can always do as well is do an inversion exercise. So you can have your knees up on a higher surface if you want to make this a little bit more of a obvious inversion, but even just leaning your body weight down, that allows baby to come slightly out of the pelvis. And then as we come back upright, it kind of allows them to shift, particularly with contractions, to get that better cervix engagement. Now you can hold these positions or do them for as long as you feel comfortable. I tend to recommend anywhere from 30 to 60 seconds. But listen to your body and see what it needs. Sometimes we can then help with some inner thigh mobility work, and I really like to sink back into this stretch here to get a bit of a stretch through the inner thigh, but we are rotating as well through the pelvis, so we're helping to create some of that uneven load in the hopes that then when we're getting contractions that they're becoming more consistent and progressive as baby's able to wiggle down onto that cervix. Now, always do both sides. You might be a bit uneven or unsteady when you're moving through these positions, so make sure you've either got stuff beside you or someone with you to help move through them, and just be careful that pelvic pain might be a bit uncomfortable in these uneven sides as well. And some squatting movements, even shifting your weight side to side or straightening through your legs coming down, having something to hold on to, and then you can try and go into a very deep squat. And again, shifting side to side. You can always do walking positions as well, and walking or even some curve walking in early labour can be quite useful. But often that's when we want to start to allow the body to move in different positions that we need. If you've made it to the hospital, if that was your plan, the midwives are often really good at telling you what positions might be best. But it's important just to listen to your body and see what it needs. Signs that we should do some movement or uneven moving positions is signs that your labour isn't progressing the way that we want. So say your contractions might be quite uneven or not consistent and progressing the way that we want. And again, doing some movement might allow baby to rotate and twist and get better engagement on the cervix. These are just a few options for you to try out. Thank you.